Shingles. What is the cause? Can it kill you? And more. It often starts with tingling pain, headaches, and tiredness, and then can lead to a painful rash with fluid-filled blisters. Most people fully recover from shingles, but in some cases it can last for months, even years. There are ways to treat shingles, and a vaccination is available to people in their 70s. The NHS website explains what shingles is, how it is caused, and what each stage of the infection is like. The stages of shingles. The NHS says shingles often starts with tingling and pain in one area, along with a headache and tiredness. This is usually followed by a painful rash of fluid-filled blisters a few days later. The blisters then burst and turn into sores. The NHS website said, usually you get the shingles rash on your chest and tummy, but it can appear anywhere on your body, including on your face, eyes, and genitals. The rash appears as blotches on your skin, on one side of your body only. A rash on both the left and right of your body is unlikely to be shingles. It can be painful and very itchy, and when shingles affects the eye, or the skin around the eye, it can cause sight problems. Can shingles kill you? Nowhere on the NHS website does it mention shingles causing death. The website says, most people recover fully from shingles, but for some people the pain can last for months or even years. This long-lasting pain is called post-herpetic neuralgia (PHN). PHN is difficult to treat, and the older you are, the more likely you are to have PHN that is severe. How long do shingles last? The rash can take up to 4 weeks to heal. The NHS said, your skin can be painful for weeks after the rash has gone, but it usually gets better over time. What causes shingles? Shingles is caused by the same virus as chickenpox, the varicella zoster virus. Almost everyone gets chickenpox at some time in their life. The NHS explains, when you recover from chickenpox, most of the virus is destroyed, but some of it can survive and remain inactive in the body for many years. This virus can then reactivate later in life and cause shingles. This generally happens when the immune system is weakened by things such as age, illness, stress, or medication. Are shingles contagious? Shingles cannot be spread to others apart from while the rash is oozing fluid. People who have not had chickenpox before could catch chickenpox from someone with shingles. According to the NHS, this is because shingles is caused by the chickenpox virus. The NHS website said to avoid pregnant people who have not had chickenpox, people with a weakened immune system, babies less than 1 month old, unless you gave birth to them, as your baby should be protected from the virus by your immune system. Can I go to work with shingles? The NHS advises staying away from work or school if the rash is still oozing fluid, weeping, and cannot be covered, or until the rash has dried out. The only time the infection can be spread is while the rash oozes fluid. The rash can be covered with loose clothing or a non-sticky dressing. How to treat shingles? The NHS recommends doing the following 4 things. Take paracetamol to ease pain. Keep the rash clean and dry to reduce the risk of infection. Wear loose-fitting clothing. Use a cool compress, a bag of frozen vegetables wrapped in a towel or a wet cloth, a few times a day. However, they urge people to avoid letting dressing or plasters stick to the rash and to not use antibiotic cream, as it slows the healing process. Is there a shingles vaccination? A shingles vaccine is available through the NHS for people in their 70s, which helps reduce your risk of getting shingles. If you get shingles after being vaccinated, the symptoms can be much milder. Simply visit your GP surgery to see if you can get the vaccine on the NHS.